Hi, fellow future RNs. Today, let's learn about Myasthenia gravis, or MG. Okay, Myasthenia gravis is a neuromuscular autoimmune disorder. So it involves the nerves and the muscles. It is characterized by considerable weakness and abnormal fatigue of the voluntary muscles, or yung mga muscles na nakokontrol natin. Here we have a neuron. Okay, the neuron is the basic functioning unit of our nervous system. So ito yung nagdadala ng messages ng mga electrical impulses from our brain to our organs or tissues, and from our organs or other parts of the body to the brain. Okay, so kapag naka-receive ng electrical impulse ng ating neuron, so from here, so from the dendrites, magta-travel yan, baba ng axon hanggang sa axon terminal, and from there, doon mismo sa a target organ or target tissue, or in this case, muscle, sa target muscle, kasi yun ang affected sa myasthenia gravis, no? It's a neuromuscular disorder. So this process is made possible by certain chemicals and neurotransmitters. Okay, first we have our acetylcholine. Acetylcholine is a neurotransmitter. Okay, it's a chemical that carries messages from our brain to our body through the nerve cells. Yung neuron nga yung pinakita ko kanina. Acetylcholine is an excitatory neurotransmitter, meaning it excites the nerve cell and it causes it to fire off the message. Like, for example, kapag sinabi ng brain natin or from the brain, magsasend out ng message na i-move natin ang ating right arm. Okay, so kapag sa process ng pag-move ng right arm, sa pag-send ng electrical impulses from the brain to your right arm, nagre-release ng acetylcholine doon sa myoneural junction. Nagre-release ng acetylcholine, tapos move natin ang ating right arm. Okay, next is yung ating cholinesterase. Yung cholinesterase naman, it's a cholinergic enzyme. No, primarily nakikita siya sa postsynaptic neuromuscular junctions, kung saan nangyayari na nga yung pag-release ng ating neurotransmitters, mag-move na yung ating muscles. It immediately breaks down or hydrolyzes acetylcholine, which is a naturally occurring neurotransmitter, pinag-usapan na natin kanina. So, binibreakdown siya into acetic acid and choline. Kapag meron tayong myasthenia gravis, there is a defect in the transmission of nerve impulses at the myoneural junction. Yung ating myoneural junction, yan yung synaptic connection between the terminal end of a motor nerve and the muscle. No, diba? Kasi kailangan ng connection doon, no, para ma-receive ng muscle yung message from the brain. So, ang ating MG is autoimmune disorder, no? But causes includes the insufficient secretion of acetylcholine and excessive secretion of cholinesterase and unresponsiveness of the muscle fibers to acetylcholine. Again, kailangan mo yung acetylcholine, diba, para mag-move yung ating muscles, para ma-receive ng target muscle yung message from the brain. Okay, so for the clinical manifestations, ang ating patient ay merong weakness and fatigue, may difficulty chewing and swallowing, so prone silang mag-aspirate. Ayan, may dysphagia, may ptosis or the drooping of eyelids, diplopia or your double vision. We also have weak and hoarse voice, difficulty breathing, course important, diminished breath sounds, and respiratory paralysis and failure. Okay, so pinaka-important yung mga risk for aspiration and risk for respiratory paralysis and failure. Okay. For nursing interventions, first we monitor the respiratory status, of course, very important, and the ability to cough and deep breathe adequately. We monitor for respiratory failure. We maintain suctioning and emergency equipment at the bedside. You monitor vital signs, you monitor speech and swallowing abilities to prevent aspiration. We encourage the client to sit up when eating kasi diba prone nga silang mag-aspirate. We assess for muscle status kasi may weakness. And we instruct the client to conserve strength, again, because of the weakness and fatigue. We plan short activities that coincide with times of maximal muscle strength. And we monitor for myasthenic and cholinergic crisis. Later, mas malalaman natin about sa myasthenic and cholinergic crisis na to. Okay, next, we administer anticholinesterase medications as prescribed. So, yung mga anticholinesterase na to, these are also your cholinergic medications. These medications increases the levels of your acetylcholine at the myoneural junction. Kasi nga, di ba, yun yung problem, mababa ang acetylcholine kapag sa myasthenia gravis. So, yung mga examples nito, like your neostigmine, yan yung mga cholinergic medications. And also, instruct the client to avoid stress, infection, fatigue, and over-the-counter medications kasi baka maka-exacerbate sila sa mga signs and symptoms. Okay. So, ang ating MG or myasthenia gravis is diagnosed through history and physical examination and also through the test called your indrophonium or tensilon test. Okay, hindi lang ito ginagamit to diagnose whether may MG ang ating patient or wala. Ginagamit din ito to differentiate between myasthenic crisis and cholinergic crisis. And the most important when performing tensilon test is to have the atropine sulfate at bedside kasi ito ang ating antidote sa cholinergic crisis. Okay, so paano ginagawa ang indrophonium test? So, yung indrophonium ay ina-administer or ini-inject sa ating patient. So, paano natin siya i-diagnose? So, kapag ang pasyente, di ba, after ma-inject yung indrophonium, kapag ang ating pasyente ay nagkaroon ng improvement in muscle strength after the administration of the indrophonium, ibig sabihin positive ang patient sa myasthenia gravis. Okay, ibig sabihin meron siyang MG. Kapag naman after the injection of indrophonium, hindi nagkaroon ng improvement sa muscle strength or nagkaroon palalo ng deterioration, ibig sabihin hindi MG ang diagnosis or hindi insufficient amount of acetylcholine, no, ang problem ng ating patient. So hindi siya myasthenia gravis. Okay. Kapag naman, for example, ang ating pasyente meron na talaga siyang diagnosed na siya with myasthenia gravis, para ma-differentiate natin, is the patient having myasthenic crisis or cholinergic crisis, we also do the indrophonium test. So, same procedure, i-inject ang indrophonium. Kapag myasthenic crisis, after i-inject yung indrophonium, ang pasyente mo, ang signs and symptoms or ang strength ay mag-i-improve. So, kung weak siya, magkakaroon ng improvement, no? Mawawala ang weakness. So, mag-i-improve ang strength. Ibig sabihin, ang pasyente, kailangan lang ng more medication. Kasi kapag myasthenic crisis, it means na ang ating patient ay under-medicated. So, tandaan, myasthenic, may A, isipin mo, under. Okay, under medication. Kapag naman cholinergic, is kapag ang pasyente, after mabigyan, no, ng indrophonium, ang weakness niya ay mas magiging severe, so hindi siya magi-improve. Ibig sabihin no naman, ang pasyente mo ay over-medicated. Cholinergic with an O meaning over-medicated. Kasi ano ba yung binibigay nating medications? Diba yung cholinergic medications? Again, ang kanyang antidote ay atropine sulfate. Kaya importante na laging merong atropine sulfate sa bedside kapag magpe-perform ng indrophonium test or your tensilon test. Okay, so again, myasthenic crisis kapag under-medicated. So, ibig sabihin kapag binigyan mo ng indrophonium, mag-i-increase ang strength, no? Mag-i-improve ang patient. Kapag naman binigyan mo ng indrophonium tapos hindi nag-improve or lalo pa tuloy naging severe, no, ang weakness, ibig sabihin over-medicated or merong cholinergic crisis ang ating patient. Okay, so that's it for myasthenia gravis. I hope you learned something today and please stay tuned para sa mga practice questions about myasthenia gravis. And please do follow my FB page, Nursing Study Hacks. Yun lang. Thank you. Bye!